So Goondir Health Services is an Aboriginal community-controlled health organisation. We provide holistic primary health care services to a client base of about 5,000 clients across a service region of about 72,000 square kilometres. Well, Goondir originally implemented the virtual health services because of COVID-19. With the restrictions that were put in place by the government, we found that our clients refused to come down to our clinics. A lot of the consults were actually done by telephone, and the fears that our clinicians had was that how could you give good quality care if it's just over the phone? So it was basically to empower them so that we kept up the quality care, empowered them so that they self-managed their own chronic conditions. And then another situation arose where by implementing the virtual services, we were able to include it into our recently co-designed InReach project, where we're trying to create a seamless journey between the public health system and the primary healthcare system.
We identified the most chronic conditions of quite a lot of our clients, after which a case conference has been done for the clients with our senior clinical lead and clinic manager and rest of the clinical team. And then the clinic manager or a clinician would talk through the client about the process and get their consent to be part of the program. With Virtual Health Services, we deliver a kit to our chronic clients, which includes a blood pressure unit, a blood sugar unit, a scale, pulse oximeter, and a tablet. So the clients are requested to do their readings, which are uploaded to a portal, and we have a clinical team who triages the readings that appears on the dashboard depending on the alert.
From a patient's perspective, I'm finding that they're becoming more educated around their chronic conditions and they're feeling a lot more connected to Goondir Health Services due to us monitoring their OBS on a daily basis.
And for patients it's very empowering because they're measuring vital parameters on a daily basis. They can see the numbers right there in front of them on a screen. Their minds will obviously perceive the trend of those numbers and they'll be able to do something about it. And as clinicians, we'll be able to know about it and do something about it. So it's empowering to patients, empowering to clinicians. I liken it to the difference between a series of photographs and a movie. So if a patient comes in 4 times a year, I have 4 photographs of that patient. If, however, they are measured on a daily basis and I get that data, then what I'm really watching is a movie of that parameter. So I think I'm much more informed.
You can sort of keep an eye on your own health sort of thing. And like if your sugar level's up, you know that it's up, and so you got to watch what you eat and that sort of stuff. So, I mean, I find it's really good. Like, it's great.
So my experience of the virtual health program has been, at the beginning, I was a bit hesitant because I was a bit nervous about the technology. But thanks to Goondir and Anne up there, I've been able to use it. It's a very easy process to follow and it's not a big deal. It only takes a few minutes every morning. So I get out all my devices, so I can do my blood pressure, my sugar levels, my oxygen and my weight, and I know with confidence that all of that information is uploaded to Goondir, and if needed, I know that a health worker will contact me. The main benefits for me are accessibility. It's really easy for me to use every day, and I don't need to go into the Goondir Health Services to do those checks. I can do them myself every morning, so I know that how I'm travelling.
The long-term outcome of the embracing of technology and particularly virtual health solutions for Goondir clients is to close the gap. Technological changes in healthcare are inevitable and the way of the future, so we can either ignore them and fall further behind or embrace them early and harness them for the benefit of our clients. Most of all, I think the aim, at least to my mind, is patient empowerment. Having the patient at the centre of their own healthcare, understanding their diseases, understanding how their behaviours and compliance and other things impact upon their long-term health outcomes. It sounds sort of almost counterintuitive, but even at a distance, technology has got the capacity to bring the clinician and the patient much closer together.